I think we may see vaccine in some populations in the beginning of next year. In the populations, it'll first go to healthcare workers. It then will go to elderly population, nursing homes. Nursing homes have bared the brunt of this, as they did back in 2003 with SARS-CoV-1. That's one of the first things I noticed back then, that there was the nursing homes were basically emptying from that particular virus. That virus is actually more deadly, but less infectious. This virus is less deadly, but more infectious, and you get more people infected, even with a low rate of disease, of morbidity, of death, the cause of death. The more of a problem there is. So it's a kind of a numbers kind of a situation, and so that population is definitely decimated. They'll get the vaccine first, and then it'll start going out to various portions of the population. We saw this also in 2009 with the flu vaccine, with H1N1. H1N1 is a vaccine that one was a different story. H1N1, the people who were most at risk were younger people, not the older people. And so we gave vaccine to people, the younger people first, and then the older people. But that's not the way this is going to work. This is going to work. We're going to give to the older population first, and then the younger population. And then, you have a significant number of people who are opposed to vaccines. I will tell you about this new vaccine, both the Pfizer vaccine as well as the Moderna vaccine. Both of those vaccines are based on RNA and lipids. They are, I've been looking at vaccines my entire adult life, and I will tell you, this is the safest vaccine I've ever encountered, which is very, very good. It is also, if this were to fail, if the results from Moderna were, it didn't work at all, that wouldn't have taken any hope out of it for me, because this is a very adaptable kind of vaccine. We can take that vaccine and we can move it around and make a new vaccine tomorrow. That's how versatile it is. And I think you're going to see a huge shift in all vaccines are going to become different now that we have this new technology. So I'm very, very hopeful about that. But the big thing about this vaccine is the safety is phenomenal.
Not all vaccines are created equally. They have pluses, they have minuses, pros, cons. Tell us a little bit about what the Pfizer vaccine might bring to us versus the Moderna vaccine versus the Johnson & Johnson vaccine.
The Johnson & Johnson vaccine is a viral vector vaccine. Moderna and Pfizer are pretty much the same types of vaccine. However, there is a difference in the formulation of the two viruses, in that the Moderna vaccine can be stored at a warmer temperature. And by warmer, I mean minus 20, which is the temperature of your freezer, your home freezer. Whereas the Pfizer vaccine requires very, very low temperature storage. And that one is going to need minus 80, which we have here on campus. Here we have freezers, or minus 153 liquid nitrogen. That's another way you can store things. So it is really that's very much limited in who can get it. But the Moderna vaccine could go to more places, like CVS, which is one of the big vaccine distributors out there, and they could put it in the freezer and store it in a refrigerator and use it all day long and deliver it. So the Johnson & Johnson vaccine and the Oxford vaccine, the one from England, both of those are adenovirus. So they're viral vector. And the problem with the viral vectors is that sometimes, you're talking about giving a weakened virus to somebody who's already sick. And so there could be bad side effects as a result of that. You will have some people who suffer from that kind of thing. Adenovirus is one of the ways we do gene therapy. I have a feeling that this new Moderna method is a way of doing gene therapy as well, much better than we've been doing in the past. And sometimes people get harmed from the virus vector itself, the adenovirus, which is just a cold, just a common cold. But sometimes if you are very sick, you can die from a common cold.